current affairs programs, and daily national newscasts, broadcast in 6 languages. To learn more about Omni Scholarships, visit omnitv.ca/scholarships.
You're watching Rogers TV, Grey County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to have as a guest Svet Milanopulus, who is a public health inspector at Grey Bruce Public Health. And today our topic is going to be well water testing and everything you need to know about keeping your water safe. Svet, thank you for being here today. I really appreciate you joining us to talk about this.
Good day, Carol. Thank you for having me.
So you and I have chatted briefly before the program because you have some very current information to share with us as a result of a media release from Grey Bruce Public Health. And that has to do about well water testing plans and what the plans are around testing in the future, especially about drop-off and picking up of samples. So I'm wondering if you mind if we just started with that, and then I have a whole bunch of questions you forwarded to me that I would like to go through as well.
That will be perfect plan on how we proceed. So water safety is an important and integral part of Grey Bruce Public Health. We do have a lot of private wells that utilize the free service in order to get the testing for bacteriological. Bacteriological testing parameters is done free through Public Health Ontario. And we've had, with COVID, there's been, with the initiation of COVID prior to the COVID outbreak, we used to be situated in hospitals. And that network of drop-off and pickups, because of the availability of the hospitals, had to pivot. And we were absolutely grateful to our grocers, our private businesses that came to facilitate that pickup and drop-off. So we went from the hospitals to the grocery stores. And they do deserve a commend for that help. So now they weren't expecting that new system to almost be in existence for 2 years. And with the hospitals prior to COVID, we had more locations as well. So now we have currently 7 drop-off locations within Grey Bruce counties. And we know that there are a few gaps within our Grey Bruce is a vast geographical area, and there are certain gaps. And we've known because of our community partners and also the residents have been sharing have been expressing themselves that there is a need. And we are very cognizant of that. So as a result, our community partners, along with ourselves, we began to lobby Public Health Ontario in hopes to augment the drop-off and pickup locations. We recently found out there is a finite resource from Public Health Ontario. And we recently discovered that they would not be able to increase the locations for drop-off pickup. So now we have to pivot again. And because it is such an important topic for public health inspectors, public health units, we are developing a local plan with the help of Ministry of Health and still Public Health Ontario, because it's through them that we have the luxury of having this free service. So our hopes, and it's a large initiative, because we hope to have a drop-off location convenient and accessible to all our residents within a 30-minute drive.
Yeah.
And currently there's a gap to that. And when we're in the process of solidifying our new plan, and that is shaping to be a little bit of a project. There's a lot of moving parts to it, and so that is the reason why it's taking a little bit to decipher. And with so many moving parts, sometimes you encounter surprises.
Yes.
Yes, ma'am.
And that's really helpful to hear. In other words, there is public health recognizing how important this is. There is a plan going forward. Lots of input, it sounds, from the public as well, because they've voiced their concerns. And what I really appreciate in what you're saying is the concept about no one should have to drive more than 30 minutes for drop off, because in the information you shared, the plan was to ensure equitable access to water sampling. And that's what you mean by equitable, that, that it's fair, but not always, within 5 minutes or 10 minutes, but there's a standard within that 30 minutes. I think that's so important. Yeah.
It's an ambitious endeavor. We do work with 17 municipalities, and how you describe equitable access is exactly perfect. We want an individual in Saugeen Shores to have access, a resident or a tourist to have access to these drop-offs the same as a Hanover resident. So within our Grey Bruce municipalities, Grey Bruce counties, both of them, that's the aim, and we have to work collaboratively with municipalities and private businesses to establish this new network. With an increase, we are going to go above the 7 that are currently there. It's minimum to a 9, but could be even more. So those are that's the plan.
Excellent. So thank you for that. So what kinds of private water systems are there in Grey Bruce?
We have a lot of private water systems. Some are drilled well. A majority of them are drilled well. We do have some older wells, such as dug or bored wells. And it's just a different type of construction. The drilled wells are metal. They tend to be more secure, less opportunity of surface water. Dug wells, bored wells have cement casings, could have cracks in them, and then making them more vulnerable to contaminants coming into the drinking water. But not only do we have groundwater sources, such as drilled, dug, or bored wells, but there is, from lake sources, springs, Georgian Bay, we do have surface water as well. And with the surface water, they tend to be even more prone to contamination because of the pollution sources. So even more vulnerable than the dug. So we do recommend treatment for surface water. Some drilled wells do not require treatment. They have continuously monitoring, and for years they haven't received a hit of total coliforms or E. coli. So that's how we know that they tend to be more secure and less of an issue, but they can, with age as well, deteriorate. So any component of water safety is dependent on 2 factors, and the factors is protecting the source and monitoring the source. That's why your first question was so important, is because it's the monitoring. We come on these networks to encourage individuals to monitor, so that's why we hope to have a more extensive network for the opportunity to monitor. It is important that we do have safe water, because it does lead to illnesses. So protecting our source and monitoring, absolutely.
So this program has gone on for a while. How long? What's the history behind the program of well water testing?
Since the creation, absolutely, we've been dealing with municipal water systems, the chlorination. So this is hundreds of years. We've been concentrating on drinking water. Absolutely, it's been pivotal for food, water, are pivotal components. There are other programs within the health unit for public health inspectors, but water is, especially in our area, maybe for Toronto residents, not so much because they all have municipal systems. But for our area, it's food and water plays a large important role in public health existence.
So as you and I are taping this program today, the sun is shining, or will be, hopefully soon, and we're moving into spring. Is spring the best time to test for water safety? Is there a better time?
Yes, ma'am. Spring is an important time. We do recommend at least 3 samples be done at a minimum per year. And spring is a good time to do it because you will either have snow melting or rain. And that's one of the conditions why you want to check it at that time, change of environmental factors to see if the well is susceptible to surface water coming in. So whenever we have floods, excellent time. Whenever there's a change of the season, an excellent time to take a water sample. When a plumber or you do any work on the well, it's an excellent time to, once our hands go in there, we can introduce bacteria that way. So that's an excellent time to test your water as well. And when you notice a change of color, a change of taste, a change of odor, that's also an excellent time to test for water.
So you mentioned that the testing is free. So there's no cost to this. If I was to put in a water sample tomorrow, how long would I have to wait to get the results back?
To get the results back through the automated system, you can achieve that within 3 days of taking your water sample. When you pick up a water bottle, there's a blue card that will have a barcode on it. And that barcode matches the water sample that you've taken. After 3 days of submitting your sample, you can punch in that 1-800 number, and the automated machine tells you what the results are. So if you're under 5 total coliforms or 0 E. coli, you have nothing to worry about. If you're over 5 total coliforms or you have any E. coli present, then they will advise you to call the health unit to get how to correct the issue. The one thing, it does take 3 days to get the raw results, but also I think it's important for the viewers to know when you're taking the sample, make sure not to have 48 hours before the lab receives it. So I would take my sample and drop it off to one of the locations the same day that I take the sample in order not to surpass that 48 hours, because it is frustrating. If it does go over 48 hours, the public health lab will tell you it's no longer suitable for testing. So prior to being worried about the results, make sure we get the test in time. And then 3 to 4 days verbal. If you tick off that you want it mailed, 7 days.
Yeah.
And the other issue to be mindful of, there is on the form an ability to pick up the report. And sometimes people are under the impression that you pick it up at the health unit, and that is not the answer. You have, if you select the pickup location, you have to go to London to get that. So just be mindful of that.
Oh my goodness. Yeah, that's not as convenient. I would not think.
No, sometimes the process is convoluted.
So just to clarify for my understanding, I take my sample, I take it in quickly, certainly don't wait, just, and is it picked up? You mentioned there were a certain number of pickup spots. How often is that sample then picked up? Are they picked up daily? Are they picked up? How would I know the timing of the pickup?
Yes, ma'am. They are picked up daily. We do have a list in the public health Grey Bruce website with our drop-off locations and the times that they go. They are picked up daily. Some locations you have to submit it before 10 o'clock because that's when the courier comes and picks it up. So each location, but you can find those details on our website, publichealthgraybruce.on.ca. You can give us a call. There's always a public health inspector online, and we can facilitate with interpretation of the results, how to take the sample, and the locations, facilitate the whole process.
So I'd like to talk a little bit about why testing of the water is so important from the health perspective, and also how you would respond if someone says, you know, I've lived here for 20 years and my well's been fine. I don't know why I need to test. If you wouldn't mind covering that.
Absolutely. It is integral because just because 20 years ago, the well did produce quite suitable results. The age of the well and the construction of the well does deteriorate. The environmental conditions deteriorate. Also, so it's not a stagnant. The issues do change, and that's why I would encourage every year to do the sampling. To do the sampling because it's a false sense of security to assume that the conditions 10 years ago or 5 years ago is still applicable to the same. And that's also, remember how we discussed when to take a sample? You will find the ground shifting. You will find so that is one of the components. If there is a flood, we're part of protecting your source is ensuring that the slope of the well slides away, that there's no debris around the well. But absolutely,
Okay.
you those things change. That's why it is in your interest to do the sampling.
So before we go into the health risks or benefits of testing and what the risk would be if there was something, we all know that we are in a world where climate events are happening more and more, and some of that includes significant weather events with downpours and a lot. Are you yourself concerned, or do you see that as having an impact on water integrity?
Yes, ma'am. We do we do see an influx of flooding events, even droughts impact your well. So absolutely, the weather patterns, the adverse weather is gonna continue, leading us to be concerned about the global warming. Not only for drinking water, recreational water use as well. When we're bathing, that's gonna be impacted. Climate change and the vector-borne diseases, a lot of things are going to be all increased as far as health concerns with our shifting, and that's why we have to prioritize appropriately. We did talk about the health risks with bacteriological infections. You can get a bacteriological intoxication, so that is gastrointestinal illnesses can result from our consuming unsafe water. It's not, don't think of these illnesses just simply 3 days of some episodes and it clears up. Some of them are deadly. Some like E. coli, 10% can result into fatalities. Another 10% you can get a kidney problem. So they're not just incidental bacterias that are just going to clear up. We can have serious complications from unsafe drinking water. That is the whole principle why we protect it, and we have to monitor it.
Yeah.
Yes,
That's helpful. Yeah, that's really helpful to know because, there are significant longer term effects that can happen, not just the acute episodes of gastro upset. So let's say my well water didn't test well or appropriately and had more bacteriological counts. From your experience, are people reluctant to test because they're afraid it will cost a lot of money to fix this? Or, I mean, is there a cost to a test that's not positive if I call public health and say, okay, what do I do? Maybe you can talk a little bit about that.
Yes, ma'am. So this is one of the convoluted components of it. The bacteriological sample is the free service that we provide.
Yeah.
But public health, if you were looking for chemicals, minerals, metals, we would not be able to help you. You would have to consult a private lab. So there is that dichotomy. If it's bacteriological, because they can make you ill, it's a free service. The chemical components, the minerals, the metals, they're more of an aesthetic. So that's why there's a little bit of a dichotomy. Of course, that those aesthetic parameters, if they're super elevated, could become a health hazard. But the acute health concern is the bacteriological, and that's free. And most individuals that do call us know that. But when they go to assess their chemical, or there is a fee for a private lab.
Okay.
And that the list of a private lab that can do those kind of analysis rests with the Ministry of Environment. But we do have that list, and we can provide it to individuals concerned about see the odor, the taste. It's more likely that it's a mineral, chemical, or a metal that's impacting you, because these bacterias, they do not have an odor, they do not have a taste, they do not have a change in color, they do not produce. So if it is those, the one mineral that our viewers should be, or one chemical, I should say, that we should be concerned about, especially if you have infants in the home, is nitrates. So that is one component that if I had a small child in my home, I would look about testing it for nitrates if they're under 6 months, because of a blue baby syndrome is called, and the affinity nitrates combine to your blood a lot easier than oxygen, and it replaces the oxygen. So that's why blue baby oxygen is depleted in the system, and then you're losing oxygen, and it could be fatal. So as a result, if your water is over 10 milligrams of nitrate, and this is where a private lab will be able to help, not the public health. Public health, the free service is for bacteriological samples.
That's really an important point about the nitrates and young babies, because so are there other ways that parents to be or new parents would know about the importance? Public health, obviously. Are they given that advice in any other forum? Do you know?
Through public health, we do have home visiting. We do have, and yes, we do share that information. There's nurses and personal support workers. It's not public health inspectors only in a health unit. So it's a multidisciplinary group. But we do go into as soon as a new baby is born, we absolutely, and we do share a wealth of information that not only can you encounter on our website, but we are out in the community and trying to reach people that way as well.
And that's really important because it isn't just looking up a website. It's someone there in your home giving you advice and having that connection. And I think certainly through COVID, people became a little bit less connected because they had no options. So it's good to hear that, that service, that personal in-home service is really, really important. So if someone found that they had high levels of nitrate or other important areas around disinfection, what do they do?
For disinfection, if it's, for example, if it's a bacteriological problem, and you've tested it, the lab will tell you, it's over 5 total coliforms, please call the health unit, and then we can talk about disinfection.
Okay.
For bacteriological, we can temporarily treat it by shock chlorinating the water, okay. which means simply applying bleach to the existing volume of or chlorine for the existing volume of water. That we call it temporary treatment because any new incoming surface water is going to recontaminate it. So if you are temporarily shocking a well, that's an indication that we already know surface water is entering because these total coliforms are high. And so that's why we call it, and you can alleviate that existing amount by introducing an appropriate amount of chlorine, but then any new contaminants, that chlorine that we've introduced is not going to be able to handle. And there's a whole lot of more steps involved in shock chlorinating. All the information's on our website, but that is a short term. And then we would tell you after you shock chlorinate, sample the water. See if our treatment was effective. A permanent solution, the cheapest way about it is an ultraviolet, but you can go to chlorination, you can go to ozone, and then less effective is reverse osmosis for bacteria because it doesn't kill them, it simply attempts to remove them. But yeah, those are the treatments. For chemicals, minerals, we can't rely on disinfection with chlorine, but we can rely on filtration to remove those. And then sometimes, depending on what mineral, what chemical you're trying to remove, it gets expensive on that. But bacteriological solutions are quite realistic and feasible.
That is so helpful to know. The message I'm hearing from you is just test your water. There is help through public health with advice, and the testing is free for the bacteriological. Svet, it has been, I can't believe how quickly the time has gone. It's been an absolute pleasure to speak with you. You always bring lots of information forward, and I appreciate your time today. Thank you.
Very much. Thank you.
Thank you. And thank you to our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Take care and stay safe.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hi, I'm Justice.
And I'm Nia. And we believe dreams fuel revolutions.
That's why we're engaging with Canadian icons and the causes they support.
Join us for these inspiring conversations and find out how you can be revolutionary.
Now you can enjoy Disney Plus on Ignite TV. Just say Disney Plus into your Ignite TV voice remote and stream Disney Plus movies and series like Marvel Studios' Black Panther, Wakanda Forever, Star Wars, The Bad Batch,
Real subtle.
and Strange World.
The world is so big.
Upgrade to Ignite TV today and get 6 months of Disney Plus on us. Visit Rogers.com/Disney to get started.